Hello, Nate Tice here again with the therapy bar. Now I'm going to be getting into a couple more specifics on how to isolate various muscles of the trunk and spine. Internal, external, oblique, for example, a big group of muscles that are very important to our trunk and spine. So let's talk about right rotation and which muscles we're going to try and work with that. So say we're rotating right, we want right internal, left external. What we're going to do is we're going to start in a kneeling position here. So if we're starting with the internal oblique, that muscle is a same side rotator. Because of its orientation a little more posterior on the trunk, we're going to be in a little bit more of a straight or slightly extended position. By putting our knee on the ground, you can see that puts this side of the pelvis into a bit more of an anterior tilt, keeping the spine neutral and body nice and erect. By locking this right up next to the rib cage, we keep the arms and scapulas from moving too much, and we do a little bit of side bend, and we can rotate and feel that internal oblique as we hold and squeeze. As we hold and squeeze, hold and squeeze, hold and squeeze. So how far do people need to go with this? As far as they can with the range of motion they've got, which is another very cool feature of this. As people progress, we just take them further. So the versatility of this therapy bar is almost endless. Now, if we want that external oblique, what do you know? We've got the left side here already because the knee is up on this side. Now the pelvis is in a bit more of a posteriorly tilted position, giving mechanical advantage to that external oblique. So now if we side bend just a little to the left and we rotate again to the right, feeling for that external oblique right on the sweet spot. So again, that's what's going to be coming with our instructional video with the therapy bar, is very, very specific cues and guidance on how to isolate each and every individual muscle. So another one, for example, if we get into the various divisions of our erectors versus transversospinalis, what we're going to find, and we'll get in very, very brief here, is if we extend the spine initially and then rotate, we get the transversospinalis opposite side rotators. If, however, we rotate slightly first and then extend, we get those more lateral erectors that are same side rotators. So again, by placing the bar in different angles and different positions of the spine, we can work different divisions, different segments. By placing the pelvis in a certain position versus neutral, again, gives more of a twisted motion, isolating very specific muscles of the trunk and spine. So I think as you guys can see me twisting and rotating on this, all sorts of different ideas are probably popping into your head, and rightfully so. This thing is endless with the number of exercises. Again, I've come up with a very, very solid foundation for people to work with and to start getting very familiar with these various sensations of all these muscles. In the scheme of things, your imagination is going to limit how many different exercises you can come up with this.